Biohazard safety for cleaning professionals. Welcome to the safety video on biohazardous waste handling. According to 29 CFR 1910.1030, workers who may be exposed to blood or other potentially infectious materials must follow specific procedures to protect their health and safety. Biohazardous waste, also known as medical waste, refers to waste that may carry infectious diseases. Understanding how to identify and properly handle this type of waste is essential for maintaining a safe workplace. Types of waste. In environments such as dental offices or healthcare facilities, waste is generally divided into two main categories. Non-regulated waste. Most contaminated items are not considered regulated waste. Examples include used gloves, face masks, disposable gowns, and protective barriers used to cover equipment. These items can usually be disposed of in regular trash. Regulated waste includes liquid or semi-liquid blood or other potentially infectious materials, also known as OPIM. Common examples found in dental offices include gauze saturated with blood after oral surgery, dental wires, and extracted teeth. If an item appears capable of releasing blood or infectious material, it must be treated as regulated medical waste. Safe handling of regulated waste. Proper handling of regulated waste is essential. Regulated waste must be placed in red biohazard bags or containers clearly labeled with the biohazard symbol. These containers must include a biohazard label and the facility's name and address. Outer transport containers must also include the transporter's name, address, and 24-hour contact phone number. Sharps containers. Sharps such as needles must be disposed of in containers that are puncture-resistant and labeled. These containers must be labeled with the biohazard symbol and marked with the facility's name and address. OSHA requires sharps containers to be located as close as possible to the point of use. Proper disposal. It is important not to fill red bags with unnecessary items. Only items saturated with blood should be placed here. Items that are only lightly stained, such as tray covers, may be disposed of in regular trash. Sharps containers should be sealed when they are 3/4 full. To properly seal the container, close the lid securely, seal it with duct tape, and make sure there are no open gaps. Once sealed, containers must not be reopened within the facility. If a biomedical waste package becomes ruptured or leaks, it must be placed inside a larger container without breaking the original seal. Transportation records. Businesses must maintain transportation receipts for at least 3 years. Records must also include the facility's operating permit and the transporter's operating permit. Safety audits. Regular audits help ensure compliance with safety standards. An OSHA violation can cost up to $13,000 per violation. Weekly compliance audits check that all sharps containers are properly labeled and containers are sealed correctly. They also check that the biohazard log is current and updated, and biohazard areas are clearly marked. Proper biohazard waste handling protects workers, patients, and the entire community. Safety begins with identifying hazardous waste, using the correct containers, and following established procedures. Thank you for your commitment to safe and professional cleaning practices.